Let's dive into this common health issue. So, my Aunt Anjali's kitchen in Chennai was more than just a place to cook. It was the heart of our family. It was always alive with the scent of spices, a fragrant blend of turmeric, cardamom, and cinnamon that danced in the air, creating an atmosphere that was both comforting and invigorating. It was filled with the warmth of family, laughter echoing off the walls as we gathered to prepare meals together, sharing stories and creating memories that would last a lifetime. The kitchen was a sanctuary, a place where we felt safe, loved, and connected. But when her kidneys began to fail, a dark cloud descended upon our family. The vibrant energy of the kitchen seemed to dim, replaced by a sense of worry and uncertainty. Everything changed. The familiar aromas were replaced by the sterile scent of antiseptic, and the comforting sounds of cooking were drowned out by the beeping of medical equipment. The doctors spoke of dialysis, a life-sustaining treatment that would become a regular part of her routine. We learned about the process, the machines, and the sacrifices it would require. And, more daunting, a kidney transplant, a complex and risky procedure that offered the hope of a better future, but also carried significant uncertainties. The weight of the decision pressed heavily on our shoulders. For our South Asian community, kidney disease is all too common, a silent epidemic that affects countless families. We realized we weren't alone in this struggle. Diabetes and high blood pressure are frequent culprits, often exacerbated by lifestyle factors and limited access to preventative care. These conditions cast a long shadow over our community's health. The decision to pursue a transplant is never simple. It's a deeply personal and complex choice. It requires careful consideration of the risks and benefits, the emotional toll, and the long-term commitment involved. It's a conversation filled with hope, fear, and endless cups of chai as we gathered around the kitchen table, sharing our thoughts and feelings, seeking guidance and support from one another. My aunt worried about surgery, the pain, the recovery, and the potential complications. She worried about finding a donor, a compatible match who could offer her a second chance at life. More than anything, she worried about being a burden on her family, about the sacrifices we would have to make to care for her. These weren't just medical questions, they were questions of identity, purpose, and worth. They touched her identity as a matriarch and provider, a woman who had always taken care of everyone else. Now, she was the one who needed care, and that was a difficult role for her to accept. For some, a transplant is a miracle, a chance to reclaim their health and their lives. For others, it's a leap into the unknown, a journey fraught with uncertainty and risk. The path is not always clear, and the outcome is never guaranteed. There's no right answer, only what feels right for you and your family, based on your values, your beliefs, and your individual circumstances. This choice is wrapped in culture, family, and belief, shaped by generations of tradition and deeply held values. It's a decision that touches the very core of who we are. Understanding both the promise and the reality is the first step, arming yourself with knowledge and information so you can make an informed decision. My aunt's journey was about reclaiming her future, about finding hope in the face of adversity and embracing life with renewed purpose. Even when the path was unclear, she held on to her strength and determination, refusing to let kidney disease define her. For every person facing this, the crossroads is personal, a unique intersection of medical realities, cultural values, and individual beliefs. Knowledge is power, so you can face that choice with clarity and courage, empowered to make the best decision for yourself and your loved ones. The kitchen may have grown quieter, the laughter less frequent, but hope simmered on, like a pot of chai gently steeping on the stove, promising warmth and comfort. This is a story of resilience, a testament to the strength of the human spirit, and it could be yours. So, what is a kidney transplant? Think of your kidneys as your body's filters. When they fail, waste builds up, making you sick. A transplant is surgery to give you a new, working kidney, usually placed in your lower abdomen. The new kidney can come from a living donor or someone who has passed away. Most people end up with 3 kidneys, the new one does the work. Finding a match is complex, but it's a gift of life. People can live healthy lives with just 1 kidney. It's a remarkable second chance. What's the biggest win people experience after a kidney transplant? It's the profound sense of freedom that washes over them. No more being tied to dialysis machines for hours each week, a grueling routine that dictates your life. The liberation from this dependence is immense. You get your time, energy, and spontaneity back. Imagine being able to say yes to last-minute plans, to embrace life without the constant shadow of scheduled treatments. I saw it with Mr. Gupta. Before his transplant, he was exhausted, his days consumed by fatigue and the demands of his condition. After, he was gardening and playing with his grandkids, a vibrant testament to his renewed health and vitality. Food restrictions ease up too. You can enjoy favorites like mangoes, savoring the sweetness without the worry of dietary limitations, and potatoes again. Simple pleasures, once off limits, become sources of joy. Life becomes about living, not just surviving. It's about embracing opportunities and creating memories. You can return to work, travel, and reconnect with family. Experiences that were previously difficult or impossible become realities. The psychological lift is huge. A renewed sense of self-worth and optimism blossoms. You're no longer defined by illness. Your identity shifts from patient to a person living a full and active life. A transplant isn't just about more years. It's about better years. It's about the quality of those years, the richness of experience. It's a reset, a chance to look forward with hope, to dream again, and to pursue those dreams with newfound energy. For many, it's the sunshine after the storm, a period of darkness giving way to light and renewed possibilities. That's why so many choose this path, seeking a brighter, healthier, and more fulfilling future. But a transplant isn't a cure. It's a lifelong treatment. Surgery is major, with risks like infection and a tough recovery. The biggest challenge, your body might reject the new kidney. You'll need daily medications to prevent this, which weaken your immune system. That means higher risk of infections and other health issues. The wait for a donor can be long and stressful, especially in minority communities. Even with a living donor, the process is rigorous. The journey is tough, but knowing the challenges helps you prepare. If you're facing this difficult decision, the weight of it all can feel overwhelming. Take a moment to just breathe. Inhale deeply, exhale slowly. Remember, you're not alone in this. There are others who understand, who have walked a similar path. Become your own advocate. Speak up for yourself, your needs, and your desires. Ask questions, never hesitate to seek clarification. Learn everything you possibly can about your situation, your options, and what to expect. Connect with support groups. Find a community where you can share your experiences and learn from others. Hearing from others who have been there can be incredibly helpful and validating. Family and friends, your support is vital during this time. Listen without judgment, offer encouragement, and help with daily needs, both big and small. Celebrate even the smallest victories along the way, and be gentle with yourself on the tough days. Allow yourself to feel what you feel, and don't be afraid to ask for help. Remember why you're on this path, what truly matters to you. For more life, more experiences, more energy to do the things you love, more time spent with those you cherish. Hope is a powerful force, keep it alive within you. But also be realistic about the ups and downs, the challenges, and the progress. This journey takes immense courage and a supportive community. You have the inner strength to face it, even when it feels impossible. Take it one day at a time, one step at a time. And in the end, it's about choosing life, embracing every moment, on your own terms, with your own voice, and with your own choices. Thanks for watching. Like, share, and subscribe to join our growing community of healthy humans.